So, good day to each and everyone. Welcome and thank you for participating to our medical video consultation or MVC online training activity and orientation. At the same time, we're also celebrating the National Hospital Week with the theme Hospitals as Champion in People-Centered Care in the Fight Against COVID-19. I will be your host for this activity. I am Dr. Eva Rose Lapitan. I'm the head of the Outpatient Department and Public Health Unit of Batangas Medical Center. And I am also from the Department of Family and Community Medicine. So before we start, let me read a few or some reminders for the participants. First, kindly turn off your microphone or set to mute. So meron pong icon sa may at lower left right side natin na pwede pong paki-mute na lang, especially when the orientation is ongoing. Orientation and training is ongoing. So we will have our Q&A session after the training part or the orientation part. And we can also send our questions or inquiries or other comments through our chat box. So sa ating pong right side, sa baba po ng list ng participants, there's a chat box there. So we can also input there our questions or some comments. So after po yung ating training and activities. And we can also, after the training activity, if you have other questions for our speakers, you can unmute your microphone and then you can introduce yourselves to be recognized, and I will be calling you one by one. So I hope this is clear to everyone, and thank you for understanding. So we would like to acknowledge of course, the presence of our medical center chief, Dr. Ramoncito Magnaye, our CMPS, Dr. Marites Teresita Torrio, and the head of our Petro, Dr. Rizalyn Villanueva. Um, before we start, let me introduce first the participants of this activity. So pwede niyo po i-unmute yung mic niyo po pagka natawag po yung department niyo from Batangas Medical Center. So let's start with the Department of Anesthesia, Dr. Jeneline De Jesus. She's the Assistant Chief President of the Department of Anesthesia. Dr. Ra, are you there? And then from the Surgery Department, we have also here Dr. Eunice Mercado. She's the Chief President, current Chief President of the Department of Surgery.
Good afternoon po.
Thank you, Dr. Ra. And then from the OBGYN, we have here our medical officer for Dr. Rachel D. Wico.
Hello?
Hello, Doc.
Hello,
Thank
ma'am.
you.
Naririnig niyo po ako, ma'am. Good
Yes, yes.
afternoon. Apa.
Good afternoon.
Good
Thank
afternoon,
you.
sir. Apo.
Also from the Internal Medicine Department, we are joined by the Chief Resident, Dr. Dan Olpindo. Hello, Doc Dan.
Good afternoon po.
Good afternoon. From the Pediatrics Department, may I call on the Chief Resident, Dr. Elizabeth F. Carandang.
Good afternoon po.
Afternoon. From Orto, we have Dr. Carl Oman Cabral, the Chief Resident from Orto. Is he here already? Wala pa yata si Dr. Carl. And then from Urology, we are joined by the Chief Fellow or Chief Resident, Dr. John Oliver Villanueva. Doc?
Good afternoon po.
Good afternoon. And then from our ophthalmology, we are joined by the Assistant Chief Resident, Dr. Maria Isabella P. De Mesa. Dora De Mesa. Thank you. And then from ENT, we are joined by our medical officer for Dr. Princess Jehan Larga.
Good afternoon.
Afternoon, Doctora. And Dr. Ana Carmina Zantua. Thank you, Doc. Also from Family and Community Medicine, we are joined by Dr. Edmund Paulo Pasqua. He is the current Chief President of the Department of Family Med.
Hi, magandang hapon po. Magandang hapon po sa lahat.
And we are also joined by our Batangas Medical Center telemedicine operators with our IT expert, Mr. Albert Blay, and our nurse, si Miss Maridal Perez. Say hi. Hello, Sir Albert.
Yung ano, ang
So,
calcium
it is also invited din po yung ating mga interns po, our new batch of interns for this activity. So, may I now call the gorgeous Miss Elaine P. Alvarez to introduce our staff from HIDU, or Health Accessibility and Innovation Development.
Okay, Dr. Lapitan, thank you. For the HIDU, other participants from our unit, so we have Dr. Dan Oliver Pasion. So he's the IT team lead when it comes to innovation development. Doc Dan. May Doc Dan din po kami dito sa HIDU. Hello, Doc Dan. Okay. Then we have Miss Fiela Angeli Lalik. So she's the project development officer. Miss Lalik.
Good afternoon po.
Then we have Mr. Henry Baichong, our IT specialist. Sir
Good
Henry,
afternoon. Hello, good afternoon, ma'am.
yan. Thank you. So, yun po, Doc Lapitan.
Okay, ma'am. Thank you, Ma'am Elaine. So, before we start the training proper, may I call now our staff nurse, Miss Maridal Perez, to lead us into prayer. Miss Dal.
Maraming salamat po sa araw dito na ipagkaloob mo sa amin upang maisagawa ang orientation para sa telemedicine. Kasama ang mga tagapamahala ng Batangas Medical Center, consultants, residents, HD4 representatives at MDC operators. Bigyan mo po ang bawat isa ng lakas ng katawan at isipan upang para ng ang layunin para sa ay mas marami pa kami pagtitinan sa kabila ng pandemic. Ang lahat ng ito ay pinag-asal sa pangalan ng pamahalaan ng Medical Father
Thank you, Miss Dal. Okay, for the welcome remarks, let's call on now our hardworking and supportive medical center chief, Dr. Ramoncito Magnaye.
Thank you, Dr. Lapitan, and good afternoon to everybody. Can you hear me?
Yes, sir. Yes,
Okay.
Doctor po.
So welcome to this activity, both from our familiar family from the CHD 4A Calabarzon, Miss Elaine and Dr. Pasha and the rest of the group, with the BAT-NC family. This is the orientation for the operations of the medical video consulting. We've started this already as a pilot program. To my family in BAT-MC, we've been doing the telehealth for the using whatever platform, Facebook or any other platforms that your departments are doing for patients that you cannot see face to face because of the pandemic of the COVID-19. And true to the theme of the National Hospital Week, which we are also celebrating. Hospitals as champions in the patient care management, especially in these times of COVID, care for the COVID. The region, when they are conceptualizing this, has identified Batangas Medical Center as the apex hospital, even in the video or teleconsult from our neighboring provinces in the region who has no access, who has difficulty going to Batangas Medical Center, or even going to private hospitals. One, because of location. They're far away. There's no specialist in this in their area. And two is because of the financial constraints. They cannot go to the private hospitals because wala naman silang ibabayad. So the concept of this was began, and we are talking with the regional director, Dr. Ed Hanairo, to how can we give access to these people with BAT-MC in Batangas City, whether they are in Tingloy or in Quezon or any other far-flung areas. Meron dong health facility, pero it's either a district hospital or a level 2, level 1 or level 2 hospital, or even a health center. So wala silang access to the specialist. So with the help of the technology, we can do this now, even without the face-to-face. And mind you, if you have visited our telemedical consult room in the OPD, you'll be amazed because of the technology that is developed. Hindi lang ito history taking because you can see the patient through internet, internet dependent pa rin naman. Kaya we've boosted our internet capability with the help of the region. You could see the patient, you could even hear the patient kasi may auscultation. Meron doong health worker or even a primary doctor or a nurse who knows how to operate these gadgets. And if you can even have some ancillary procedures like ECG, ultrasound, or ophthalmoscope, you just have to be in contact with the health worker there. For example, in Quezon, the Claro M Rector hub, there is the patient there. You could talk for the history, you could examine the patient, you could even do ECG and the likes. They even have an ultrasound for OB patients and other conditions. So this is a very good opportunity for all of us. That's why we are tapping our medical specialists and medical officers, consultants at that level, so that they will have access to the consultants. Anyway, this is a scheduled procedure, so that we will just talk about the availability, and so that the patient will come in, for example, in a faraway area in Quezon, and then connect through the internet, and we could do all the things here. And we can even do e-prescriptions, and do prescriptions or photograph the lesions. So this is a very good way forward for all of us. This began during the universal healthcare because of the promise of the accessibility. But I think it is very opportune time now because of the COVID, which really prevents us or diminishes our face-to-face consultation, especially in the OPD and the emergency room. Pero mostly OPD lang naman. So I look forward to the operations of this very worthy project with coordination with the Center of Health Development or Region Calabarzon. So thank you to Dr. Hanairo. Please give my thanks to the people of CHD. And let's continue as one. They are there, our patients in the outskirts. We are here in BATMC as the central hub so that they can refer patients to us. And we have the capability to give the quality care and even the specialty or subspecialty care. So together, we will fight this virus. We will empower our specialists and also the patients so that we can move forward and hopefully we'll end this pandemic of COVID-19. So good luck to Dr. Eva Rose Lapitan and her team for the success of this project. And to all the members of the BATMC, we should cooperate. We shall cooperate for the success of this worthwhile project. Again, good afternoon. Thank you very much. And this meeting may be a success. Thank you.
Thank you very much for your insightful message, Dr. Ramoncito Magnaye. So I will now introduce for the training part, I will now introduce Ms. Christine Elaine P. Alvarez. She's a nurse 5 and head of the HIDU to talk about the introduction and scope of telemedicine.
Thank you, Dr. Lapitan. So, before I start, so in behalf of our regional director, Eduardo Hanairo, we would like to thank BATMC headed by Dr. Magnaya in being our partner for this project. So, we at Haido din po is very happy that there will be more pool of doctors na magpa-participate po sa project natin. No? So, I'll be starting my presentation. Okay po ba yung voice? Naririnig po yung audio?
Okay.
Okay po. So, are you seeing my presentation na po? Can I proceed na po?
Yes.
Okay, thank you. So, I'll be presenting the medical video consult training for telemedicine program in Calabarzon. So, this is the outline of my presentation. So, the first part will be presented by yours truly, then the latter part will be presented by Dr. Dan Pashon. Okay. So first, so the commonly used term, syempre po mag-uumpisa tayo with telemedicine. So it is defined by the World Health Organization as the delivery of healthcare services, where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interests of advancing the health of individuals and their community. So it's not secluded lang po with online consultation. So broad po yung telemedicine natin. So it pertains also to research, continuing education, etc. So, in this project, we will also encounter, syempre po, yung pangalan mismo na ating project, which is the medical video consult. It is a process of consultation that involves technology deployment of telemedicine equipment that includes plug-in devices, yun na-mention po ni Dr. Magnaya kanina, to aid real-time video consultation. So next, we have the medical video consult operators. Sila po yung mga sinabi kanina ni Dr. Eva na si Miss Maridol, saka yung iba po nating mga staff, si Sir Albert, na naka-deploy po sa ating mga sites. So this refers to the assigned telemedicine staff. So it's either the health worker or the information technologies who operates the machine and its plug-in devices. So next, we have the term called spoke. So this is the telemedicine patient site, and this is also where the referring physician is. So kung nasan po yung patient, nandun din po yung ating technology, the machine, and yung ating satellite po. Next is the term called hub. So this is the telemedicine provider site, and this is where the attending physician or the specialist is situated. So sa hub po, yun po yung ating BAT-MC and yung ating QMC. So doon po yung ating mga specialists. So sa telemedicine po, we always have the spoke and the hub. So yun po. So ano po ba yung mga governing policies na kinonsider natin in drafting this project? So first, we have, of course, the Universal Healthcare Act with Republic Act 11223. So it states that it shall ensure that all Filipinos are guaranteed equitable access to quality and affordable healthcare, goods and services, and protected against financial risk. On its IRR, it was emphasized din po that assurance of member access to all levels of healthcare provider networks, whether access through healthcare facilities or remotely through the use of digital technologies for health. So, na-acknowledge na rin po doon yung telemedicine natin no, sa Universal Healthcare Act. Next, we have the National Objectives for Health 2017 to 2022. Under specific objective number 5, it states that the DOH will consider appropriate innovations in health like telemedicine and digital health tools that can help those with chronic illness manage their health. And next, meron din po tayong Administrative Order number 2018-0014, yung ating Formula 1 Plus for Health. And meron po siyang tatlong points that was highlighted. First is to increase access to quality health products and services. Next is to ensure equitable access to quality health facilities. And next is to ensure equitable distribution of human resources for health. So alam naman po natin na limited lang po yung access to doctors. That's why telemedicine will be an instrument for them to reach the services of those doctors po. So next, ito na po, no? So after gaining the principles na nandun po sa national issued policies natin, we drafted the Regional Memorandum number 2019-01-07. So ito po yung sinasabi ni Dr. Magnayan na nag-pilot po tayo last year. So around September to the first week of December, nagkaroon po tayo ng advanced implementation of the medical video consult. So yan po, i-discuss ko na lang po later yan specifically mamaya. So, in 2020, yun nga po, just in time, ang ating telemed po. So, the national government has recognized the importance of telemed. Siyempre po, for COVID-19 din po dahil yung mga communities would not be able to go out of their homes. Kaya po, ito po yung ating magiging platform for us to give that services in the comfort of their areas. So, FDA Circular number 2020-007 was released. So, this is regarding the guidelines in the implementation of use of electronic means of prescription for drugs for the benefit of individuals vulnerable to COVID-19. So, lately lang po yan, pero ginagamit na po yan for prescription of medications. Next is the Joint Memorandum Circular 2020-001 of the Department of Health and National Privacy Commission. So, yun po yung guidelines on the use of telemed in COVID-19 response. So, dated March 28, 2020. So, ang nakalagay lang din po dito, how do we secure the records of the patients? Siyempre po, yung privacy natin and other concerns regarding the privacy of the patient. Yan. Next is the Joint Memorandum Circular 2020-001 of the Department of Health and University of the Philippines, Manila. So it was parang ang kasama po dito is the National Telehealth Center of the Philippines of UP Manila. So they developed the telemedicine practice guidelines. So we are happy that our region po has contributed to the development of this issuance. Kasi po last year naghingi po sila ng mga nagawa natin na mga protocols, lahat po ng mga guidelines. Then sabi po nila kasi they will be developing that specific issuance. So yun po. We are glad to help naman din po since we've done the advanced implementation. So next, so because of that, syempre po tayo po mag-adjust din po tayo dun sa mga na-issue na policy. So we have issued these three policies. So first is from the advanced implementation, yung pilot po natin, we go now through the rollout. So ito pong rollout natin, nag-start siya May of this year. So yun po. So that guidelines, nakalagay po siya sa Regional Memorandum Number 2020-02-16. Next, we also have Regional Memorandum 2020-0307 and amendment for the rollout implementation 0216-A. So yan po. So those guidelines, yun po yung explicitly i-discuss later para po for your guidance. So the procedure and all, yun po. So what are other telemedicine projects po in Calabarzon that is being handled by the Health Accessibility and Innovation Development Unit? So first, we have the HIDOC. Yun po yung sinasabi natin, Health Access Innovation of doctors offering online consultation. So this utilizes a Facebook Messenger to provide a free online medical consultations by licensed DOH Calabarzon physicians to people who are not able to go out of their houses during this time of quarantine. So this is conducted every Mondays, Wednesdays, and Fridays. So yan po iba sa mga pictures kasi po mga CHD doctors po naman yung umuupo dyan. Okay? And as of July 29, we have catered 289 patients and provided with medical consultation. Yan. Next is also we have the medical call consult project. So this is the access to 24/7 hotline manned by licensed doctors who provide medical advice, general health information, and advice on permissible medication over the phone. So yung kanina po, 'di ba, video, ito naman po ay through audio. So phones po, deploy po tayo ng 80 units of this what we call the voice telehealth kits. So cellphone po iyon na may subscription to Consulta MD. So binibigay po namin 'yon sa mga barangay health stations, yung mga walang doktor na GIDA po. So there they can access the consultation from the doctors po from Consulta MD. So Consulta MD has this pool of doctors, private po, mga doctors natin that gives the consultation. So tayo po ang nagbabayad dyan, may monthly subscription po tayo for those 80 units. So 80 barangays po yung recipient po ng project na ito. And of course, we have ito pong project natin, the medical video console. So this involves the deployment of one standalone machine and two telemedicine portal card system with the following plug-in devices. So marami po siyang plug-in devices. So makita po nyo, so this one is the hub. Nandun po yung ating mga specialist. Then, this is where the patients are. Sa spoke po natin, yung dalawang may patient. And ito po yung tinatawag na telemedicine area. So, that is where nakalagay po yung ating equipment and kompleto po siya sa mga bed and all other plug-in devices. So, Mr. Henry Baichong, can you post the video po ng ating ginawang advanced implementation?
Yes po, ma'am.
Parang diyan kami
Malinaw po.
malaking pag-asa po. Gawa nung pong i-consulta yun sa telemedicine ay doon po nakita yung pala may doong komplikasyon na sa baga.
Ang telemedicine natin in Calabarzon is actually a very important tool to respond to the need to equitably distribute accessibility ng healthcare to the people, especially sa mga priority areas natin like indigenous people at itong ating mga GIDA areas o yung mga
bali po dito sa Tignuan, marami po siyang nakikater na mga pasyente na kagaya po ng mga cases na sa pedya, hindi na po nila kailangan pumunta sa Manila o sa Lucena. Dito po, nasa-check up na siya, tapos nabibigyan na po ng mga reseta kung saan nakakatipid po sila sa pamasahe. At ayun nga po, hindi na nila kailangan pumunta pa sa malayong lugar. So yun po, nakakatulong din po siya kasi halos hindi naman po lahat pero karamihan po ng nakatira dito ay hindi po well-to-do. So yun, isa pong malaking tulong na na-check up na sila agad-agad, hindi na lumalala yung mga sakit.
I think theoretically it would bring specialty care to those areas using the limited functions of the equipment that is available to our doctors.
Thankful po kami dahil nabigyan kami ng pagkakataon na mabigyan ng isang proyekto ng DOH na talaga pong sa tingin namin ay kapaki-pakinabang.
Medical video consultation or telemedicine was created and was formed with patients in mind. It's like a virtual visit of our patients coming from far-flung areas like in Quezon to Batangas Medical Center.
Taga-Infanta at taga-Real, nahihirapan sila pumunta dito kasi 3 o'clock ng umaga pa lang nagbabiyahe na po agad sila. Unlike po na may telemedicine, kahit po doon lamang sa Claro, sa district hospital po nila, pwede na agad po sila doon pumunta para po ma-check up ng mga consultant po natin dito sa QMC.
Ang telemedicine po ay isang napakagandang programa po ng Department of Health dahil ito po ay nakakatulong sa mga mamamayan ng karatig bayan ng Real Infanta Nacar. Alam po naman natin na ang bayang ito ay remote areas na kailangan po na mapagsilbihan po natin ang ating mga mamamayan sa pamamagitan po ng telemedicine.
Provides an on-time referral and consultation from isolated or far-flung area to our institution, which is very comfortable at the same time to the side of the patient.
Amin po dito sa Real, napakalaking bagay po na kami po napili para maging pilot para sa ating telemedicine program. Ang mga advantages po nito, unang-una, natutulungan po natin yung mga pasyente natin na maibsan yung financial hardships po nila sa pamamagitan ng paglimita na sila ay magbabiyahe pa, pupunta pa sa espesyalista. Sa karaniwan po dito sa amin, ang espesyalista po ay pinupuntahan po sa area ng Laguna or Lucena or Manila na inaabot po ng halos 4 na oras na biyahe.
We are very pleased that telemedicine has reached our institution, and because of this, we are able to deliver healthcare to underserved communities, and at the same time, these people are able to access consultation with our medical specialists.
Marami pong advantages dito sa ating telemedicine na nakita na inilagay dito sa Batangas Medical Center. Ang unang-una po ay access. Ang ibig sabihin po nitong access to quality healthcare. Ang ibig sabihin po nito, ang Batangas Medical Center po ay isang level 3 DOH retained hospital. So nandito na po yung mga espesyalista at saka yung training programs ng iba't ibang mga serbisyo para sa ating mga pasyente.
Under universal healthcare, we have the principle of pool of government, and the principle of pool of system, and pool of society. This is a very good model, good example to make use of that policy para maipasok natin yung mandate ng universal healthcare. So, to sustain the program, we need everybody, all stakeholders, to be part of the program and understand the program. Second, we need the funding to continue with activities under telemedicine. Now, one of the basic mandate of the law is to let PhilHealth get into the funding system. Although there is the so-called special health fund, now the special health fund earned from PhilHealth should be the one to sustain the use of this gadget, the maintenance of the gadget, the installation of the gadget, and the access of the people to the gadget. So this telemedicine product is necessary to be funded, especially by PhilHealth and all funding agencies, the local government units, and international funding agencies para maka-exist siya not only in those given areas but in most areas they are needed.
Medical video consult ay tugon sa ating kakulangan ng doktor dito sa Grado Epekto. Ako'y nagpapasalamat at nagkaroon kami ng telemedicine dahil sa isang araw ang doktor ay nag-isa. Siya ang naghahawak ng ER, ng ward, tsaka outpatient. So, ang medical video consult ang sagot sa outpatient department. Nagkakaroon ko ng agarang pagtingin sa mga pasyente.
Health technology assessment to provide the support in the expansion of the program. Most of our laws have been talking about the present situation, but the laws in e-health should be a projected law that will be quite prophetic, tell us and let us adopt a new technology higher than what we have today. So that should be a idea. Part of the mandate of universal healthcare, role of government, role of society, and role of system methods or strategies. I would encourage all our local chief executives from the province up to the barangays to look into our areas and see how we can let our people access to the health system, especially in the four entries that they need the health system. A health system that would be more proactive, more responsive, using the technology existing today. So ito yung pinaka-importanting pag-isipan natin. Huwag natin pag-isipan sa dami ng tao na meron tayo sineservisyohan, kailangan marami rin health worker. It's better that we think of other ways, other means to get the people to the health system. So ito yung aking encouragement sa inyo. Look into the needs of the people, get into the situations, get the terrain, then we will telemedicine.
Thank you, Sir Henry. So, yun po yung nangyari sa ating advanced implementation, no? So, during the advanced implementation, last September to December 2019, we catered 72 patients and 50 patients were provided with prescription and others were given medical advice. And 18 of them were referred to the highest next facilities. So, we are glad din po to inform you that syempre po, as partner, we share this award. We have received the following awards in recognition of our telemedicine efforts po, no? So, kasama po natin ang BAT-MC kaya po natin nakuha itong award na 'to. So maraming salamat po sa mga, nag-participate po na mga doctors and siyempre po sa support po ng management ng, both of the CHD and, BAT-MC. So 'yan po. So next, ano po ba yung objectives natin dito 'no, sa project natin? So first is to provide access of medical consultations from licensed physicians, general practitioner and specialists to the communities belonging to the geographic, isolated and disadvantaged areas of the region through the deployment of this telemedicine. So for information po 'no, we have, 46 municipalities and 180 barangays categorized as GIDA. So malaki po talaga sa buong Pilipinas po tayo ang pinakamalaking number of GIDA areas po, no? So next is to assist the frontline physicians in managing the health conditions of the community, specifically on cases needing specialized level of care. So ito po, ang telemedicine natin specifically is the medical video consult aims to assist yung mga nandun po sa ating mga RHU. So tayo po yung magiging bridge para po makuha ng mga communities yung specialized level of care. Next is to conserve travel time and expenditure, including reducing waiting time, thus improving patient visit experience. So, hindi na po sila kailangan tumawid ng isla, gumastos po, at syempre po, hindi na po sila ganun katagal magpila kasi po, in-schedule po talaga yung mga consultations nila. Okay? Next is to gather patient data through documentation of the video consult service and integration to the individual treatment record contained in the facility to facilitate the continuity of care. So meron po tayong procedure dito, systematize po yung ating telemedicine procedure. Meron tayong record management na sinusunod para po ma-facilitate yung continuity of care. So next, ano po ba yung mga plugins that is embedded in this technology? So, yung sinabi ko po kanina, meron po tayong standalone machine. Ito pong standalone, nandun po ito sa Claro M Recto. Ito pong portable card system, yung kahit saan po pwede ito madala, provided na may internet access. So, yan po ay nasa Real RHU at nasa Tingloy RHU. So, iisa-isahin po natin itong mga plug-in devices. Papakita po namin sa inyo, no? So, along with the slide, I will be showing you ito pong legend. So, first, ang MVC, HW, ibig sabihin lang po niyan, allowed po yung ating health worker to operate that specific plug-in. Next is for referring physician only. So, mayroon po tayong plug-in kasi na ang preferred po lang namin mag-operate is the physician since there will be the rural health unit or the municipal health unit, the DTTB, or we would like to parang acknowledge the presence of Dr. Pat Mandokdok. So, nandyan po siya kasama natin from Tingloy. So, yan po. So, first, plug-in device is the multi-scope camera system with accessories. So, yan po yung specific specifications niya. So, meron po siyang different lenses that can be attached. So, first is the HD general imaging lens. So, it has the following specifications. So, ang output po niya will be like this. So, it can be parang zoomed pa and kung may gusto kayong ipa-emphasize na specific part of dito po, pwede po. So, yan po. So, this is the Agnes Interactive interface po pala. So, this one is the spoke site. And this one, nandun po makikita yung doctor natin. So, yan po yan for the HD general imaging lens. Next, we have the otoscope lens. So, attached po siya dun sa ating camera. So, it has the following specifications. So, ito po yung mapoproduce niyang photo. So, all of the pictures na mapoproduce po will be saved doon po sa ating software. So, yan po. So, ganyan po siya kalinaw. So, ayan. So, next is the dermoscope lens. So, ito po yung specifications. And the output of the picture goes like this po. So, yan. So, malinaw po talaga siya. Next is the ophthalmoscope lens with the following specifications. So, it can produce a photo like this. Yan po. So, habang ninanavigate po, pwedeng mag-instruct po si specialist kung ano ang gusto niyang i-emphasize po na site, no? So, next is the ECG. So, meron po siyang ECG and it produces ito po. Yan. Next is the interactive stethoscope. So, dinidikit lang po siya yung kanina sa video, kung nakita nyo, di ba po, nilagay lang dun sa student, then naririnig na po yan sa headphones ng doctor on the hub. Ayun po. Next is the spot monitor. So, every time po makuha yung VS from the spot monitor, automatically po siya nagre-register dun sa Agnes Interactive. So, lumalabas po siya agad dun. Nagre-register agad. Okay? Next is the digital spirometer. So we would like the referring physician to operate this. Opo. Since yung sa ibang courses naman po, like sa nursing and midwifery, I think hindi po siya na-cover yung sa skills training for this one po, no? So next, ayan po. So yan po yung ilalabas na report after using that specific plugin. Next, we have the abdominal USB ultrasound probe. So, ito po, health worker din po siya, pero provided that there will be skills enhancement training to be undergone by those MVC operators po, no? And of course, with the help of the specialist, kung saan po yun gusto man-navigate o maneuver yung device. Next, ayan po. So, yan po yung sample ng output ng device. Next is the vascular USB ultrasound probe with the following specifications. So, yan po. Next is the vaginal USB ultrasound probe. So, we would like that yung ating pong mga referring physician will be the one to operate this since wala pa po tayo specific training for the MVC health workers na maghahawak po nito, no? So, sila Dr. Pat po, sila Dr. Racora, yung mga ating physicians na nandun po sa ating mga spoke, sila po yung nare-request natin na mag-operate po nitong device natin. Next, ito po yung Agnes Interactive. So, this is where the consultation happens. This is also where nasa store po yung ating pictures, the data of the patient. Yan po. So, yan po yung kasama nung ating telemedicine device na ginagamit po natin. So, yun po. So, the project sites, yung sinabi ko po kanina. So, the telemedicine portable cart system is deployed sa ating Tingloy RHU. At ang hub naman po niya is Batangas Medical Center. So, ang target days po natin for consultation is every Tuesdays with the consultation hours of 10 to 12 p.m., 10 a.m. to 12 p.m., 1 to 3, and 3 to 5. So, the schedule still depends for the availability of the specialist na magkikater. So, Dr. Dan will explain to you later kung paano po yung ating scheduling. Okay, para viewable po doon sa ating spoke yung mga available specialist din po. So, every Wednesdays naman po, ang Claro, Recto, nandun sa kanila yung standalone machine, yung malaking machine natin. Every Wednesday sila sa Quezon Medical Center. And every Thursdays po sa Batangas Medical Center po sila. Okay, so summary lang po. Real RHU pala, then Quezon Medical Center. For the summary, so we have Tingloy RHU every Tuesdays sa BAT-MC, then Clara M. Recto every Thursday sa BAT-MC. So sa BAT-MC po, Tuesdays and Thursdays po yung ating consultation days. Okay, so kung mapapansin niyo po, may satellite din po dito sa ating spokes kasi aside from the equipment that was deployed, we also installed the dedicated satellite para po doon lang talaga siya, yung internet natin naka-focus doon sa equipment para medyo para malinaw talaga yung ating pag-send ng video feeds sa ating hub. So yan po. So for other parts of the scope, so for this to happen, ang ating pong project, we will be forging a memorandum of agreement between the CHD Calabarzon with, of course, the Batangas Medical Center. I believe po nasa amin na po and for signature na lang po ni RD Hanairo. Next, the municipalities of Tingloy and Real for their rural health units, DocPat follow-up. Next is the provincial government of Quezon for Claro M. Recto and Quezon Medical Center since nasa under po siya ng provincial government yung two facilities natin. Okay? So next, ito po. The consultation is limited to outpatient services and what can be done via remote instruction to the MVC health workers excluding emergency cases. Of course, may limitation po itong telemedicine. So, telemedicine does not hope to replace the traditional in-person consultation, but assistive lang po siya and may limitations. Yun nga po. It will not be the answer for emergency cases. Thus, if further examination requiring skills, training, and or additional preparation, such as inserting dyes for uh, sa mga of the cases and other supplies not regularly supplied by the regional office is needed, then referral to the nearest health equipped facility shall be made. Okay. Next, days will be set for a specific specialty. So, yun nga po, i-discuss po ni Dr. Dan mamaya kung paano po yung ating e-calendar nangyayari, no? So, next, subject to the availability of specialists for or internal arrangement of the hospital departments and the hubs. So, yun po. So, as I mentioned, meron nga po tayo electronic calendar na tinatawag. So, for the procedure, Doc Dan, are you ready? Hello, Dr. Dan Pasion. Can you share your slides na po?
Good afternoon. Kita po ba? Is it visible? Ayun. Ito. Nakikita niyo na po?
Yes, Doc, proceed.
Thank you. So, good afternoon again, doctors, Dr. Magnani, Dr. Lapitan, Dr. Ritorio, Doc Mandokdok, and to the department chiefs. So, for part 2 of the presentation, I will be discussing the procedure on how we operate the telemedicine, specifically this project MDC, the roles and responsibilities of the participating institutions, and ways forward. So for the procedure, it is divided into first the preparatory phase, and it starts with the deployment of the staff and equipment. So as mentioned earlier, last year we already started the advanced implementation or the pilot phase, and before that we hired telemedicine staff to be deployed in the facilities, in the spokes, and in the hubs. So for BAT MC, we have Mr. Albert and Ms. Maridal uh, to assist in the procedure. They also deployed the telemedicine equipment, as mentioned, the standalone into portable card systems for the three facilities. Aside from that, we also deployed uh, PCs or desktop computers to the hubs. So for uh, Quezon Medical Center and Batangas Medical Center, we deployed those desktop PCs. So here is the picture of the Annex A, which contains the position of the hired staff along with their tasks, enumerated tasks. So next, we designate the consultation area. So prior to the start of the pilot phase, we went to the hubs and the scopes, and along with uh, the personnel there, we designated an area for the consultation, for specifically for telemed consultation. So this is how it looks like for the hub. It contains the table along with the computer and the chair, and at the back you can see a Sintra board. So during the consultation, the doctors and the patients and the MDC health workers and ITs can see which facility they are referring to. And this is how it looks like for the scope. So for the scope, there's the telemedicine machine, the Hamilton bed, and the chairs for consultation. And lastly, for the preparation, we identify the doctor. So as mentioned earlier, there's a pool of doctors which we uh, seek in order to give services to these people. So we tap into Batangas Medical Center and Quezon Medical Center for this specific project. So for the next phase, we go to the execution phase. So this is the actual consultation. So it starts with after we identify the doctors, the MVCITs will then provide this form and fill up this form so that we will be able to put it in the electronic calendar. So for this form, we have the date, the time, name of the physician, and the specialization. Initially, what we did was, as mentioned earlier, there's a specific number of hours for a certain specialty. So for example, 10 to 12 may be for internal medicine, 1 to 3 may be for ENT, and so on. However, there seems, in order to allow the consultants and the uh, other doctors or specialists provide their time and services, mas minabuti po natin na ano na parang ano na lang free, no? So in coordination with Dr. Lapitan, the department heads may opt to kung sabihin po nila kung ano po yung availability ng services na pwede nila ibigay. So if that's already filled up, the MDCIT will then put it in the electronic calendar. This electronic calendar can be viewed via the internet browser. So from the side of the patient, they can see the schedule of the doctors. So the MHOs or the PDs can deck or can assign which day nila ipapatingin sa specialist yung mga pasyente po nila na kailangan ng tingnan ng specialista. So next, for the pre-consultation testing. So before the actual consultation, our telemedicine operators, the MDC operators, especially the ITs, they conduct a pre-consultation testing of the equipment and devices, no, including the internet connection, so as to facilitate smooth and steady consultation during the actual process. So they will be using this form for the scope. So this is just a checklist, no, in terms of the functionality, the Likert scale in terms of the quality of the devices. Then for the hub, for the desktop computer, and its plugins. Next, after they check the connection and the equipment and everything is functioning well, they will send the spoke IT will send the URL link to the hub IT, so they will be able to access Agnes. Yun po yung gagamitin na software that runs the telemedicine device or the telemedicine equipment. Parang dito rin po, di ba, before we were able to go to this online conference, may provide na link sa atin. So, ganun din yung app, yung Agnes. Every time magkakaroon ng consultation, meron pong private na URL, yung telemedicine equipment, yun yung sinesend ko sa hub para ma-access yung consultation. So, you might be wondering, baka yun nga, meron kasi issues about privacy. So, specific lang yung URL, yung IP address na yun for the hub at the time. So, if may ongoing consultation dun sa BAT-MC, sila lang yung makaka-access. So, next, endorsement of the patient by the spoke physician to the MVC hub. So, before the actual consultation, as nangyari din sa advanced implementation namin, it was recommended by the hub doctors, the specialists, that before consulting them, mas maigi kung tignan na ng MHOs or the TPPDs, no, sa referring physicians. So, the referring physician will deck in what day the patient will be seen by the specialist via the electronic calendar na pinakita earlier. So, during the actual day, so kunwari nandyan na, na-deck na yung patient, dumating na siya on the day itself. So, i-explain yung procedure, what is telemedicine, and kung papayag siya, he or she gives the consent, nasasagutan niya via this form. Then we will proceed to the procedure and getting the vital signs, anthropometrics, and using the plug-in. So the MDC health worker, upon checking the vital signs, getting the general data of the patient, will then endorse the patient to the MDC health worker of the hub. And the MDC health workers of the hubs will then endorse the patient to the on-duty telemedicine specialist. So during the actual special consultation, we're all familiar with this. No? So every doctor naman, pare-parehas naman, ganun pa rin po yung procedure natin. We will start with the history taking. No? So then followed by the physical exam. And the physical exam will be aided by the plug-ins. So whatever plug-in you might suggest doing or kailangan po natin, you may give instructions to our MDC health workers on the spoke side. And then upon diagnosis and treatment, you may then provide a prescription or you may provide a referral form if you think that the patient is not suitable for teleconsultation and needs person-to-person or actual visit to the doctor. Or you may opt din na pwedeng wala dun sa dalawa. So, syempre, not all patients require pharmaceutical treatment. Yung iba, medical advice lang. Pwede rin naman po yung ganun. So, after the actual consultation is done, the MDC health workers and ITs will get the feedback and documentation. So there is a form for the patients for the spoke side. So merong, and also there's a form for the hub for the doctors. Now, in order to provide improvement and better services, kaya po nagkaroon ng mga ganitong form. So this is just a Likert scale from 1 to 5 with some open-ended questions for then aside from the feedback forms, the MVC operators will also assess record the patients for the day in an online Excel format for the patient record. So, parang yung logbook lang din po yan sa OPD. You may also opt to have that same logbook for hospital purposes. Then for the final step, the MDCIT will be conducting, kung merong pre-consultation testing, may post-consultation testing din. So, to make sure na the equipment was not damaged during the actual consultation. So, ganun din po, same form. And in cases of may damage din sa mga equipment or devices, there's also an incident report form in which they will provide and coordinate with CHD or via HID, RU. So, for the next part, the roles and responsibilities. If you have any concerns, you may put it in the chat and we will answer them later. So for the roles and responsibilities, number one, for CHD Calabarzon, so through Health Accessibility and Innovation Development Unit, ID, our unit, and the telemedicine program, allot funds for the procurement and deployment of telemedicine equipment, network connectivity, and other supplies, materials, and infrastructure. So as mentioned, this was already done. The devices, the equipment are already deployed, and the properties are already transferred to the respective health facilities. Next, hire and deploy telemedicine staff to the spoke and hub. So, as of now, we have already deployed to all the hubs, to QMC, BatMC, and to the spokes, Real RHU, and Claro. However, we're still lacking for Tingloy. So for now, if ever are going to start, we will operate uh, with the help of their RHU staff temporarily. And next, make a contract with the service providers for equipment and infrastructure maintenance, warranty, and technical assistance. So we have contacts with the distributor of the telemedicine equipment. They are made by AMD and are distributed. We have a local distributor in the Philippines. And for the satellites, we also have a contact for the satellite providers, internet providers for VSAT. Next, issue guidelines. As mentioned earlier, the guidelines for the advanced implementation and the rollout are already signed. So we have already provided this via email. And if you want or can't find the copies, you may message us and we will provide you with one if you need them. So together with the service providers, orient and train health personnel deployed in the LGUs or the scopes on how to operate the telemedicine equipment. So we have already done this last September and we were supposed to do this last April. However, due to the pandemic, it was delayed and we're opting for webinar type of training. Next, to monitor utilization, functionality, and operationalization of the medical video consult service, pre and post deployment, and to include feedback provisions of the proof of concept to the recipient LGU. So this is one of the goals why we made feedback form. Next, to provide recognition and incentive to participating facilities and specialists in support of the implementation, subject to the availability of funds. And next, to contact medical specialists. So as mentioned, we have made a MOA with BatMC and other health facilities to seek help or in order to provide specialized treatment. And next, to conduct documentation and research of the project for improvement in the future. Next is the PHTO. So we at the region in Manila, we have an arm in Quezon and Batangas which helps kung may concerns po kayo, then approach them. So we assist HB Calabarzon in the orientation, monitoring, and other technical assistance. We also coordinate with the recipient LGUs, the hubs, and our unit for concerns. Next, include medical video consult as for BAT-MC. Number one, to include MDC as one of the services being offered, specifically as the hub for Tingloy and Claro M Recto, thereby accepting referrals for specialty cases. So the services shall utilize and adhere to the issued guidelines. Next, the hospital shall provide a designated area for the consultation. So this is already done. And safeguard the devices, supply, and fixtures provided by the region. Next, to guarantee that the medical video consult service continuously operates at and is manned by trained professionals and staff. And next, to raise concerns, project and technology experiences, to facilitate the execution of the appropriate action and improve the service delivery. Next, to respond and report to monitoring and research activities by the region. And lastly, to sustain the project through adoption of the medical video consult service in their hospital by ensuring the availability of connection, coordinating linkages for the spokes, among others. So for the future of this project, the LGUs will eventually, hopefully, adopt the project, and from there, sila na po yung bahalang mamili or makipag-coordinate kung saang hospital nila gustong or prefer na mag-consult, magkaroon ng link or maging hub. And ganun din po sa um, mga hubs natin kung ano po yung gusto nilang bigyan ng service ng mga schools. Next, for Tingloy, sa mga spokes natin. So, in general, the roles and responsibilities mentioned for the hubs, ganun din karamihan naman for the spoke. No? So, number one, include the services. So, as a spoke, uh, to include the services offered in the RHU in order to refer the cases to the specialty hospitals. Okay? So, they would also designate an area for the consultation, safeguard the supplies, and guarantee that the service operates and is manned by trained staff to raise project and technology experiences and monitoring activities, research activities, and to sustain the project through the adoption of the technology. So, what will be our goals or ways forward for the future? So, number one, as mentioned during the discussion of the plugin, there are some plugins na medyo advanced for our staff. No? So, they will have skills enhancement training, or we will be having skills enhancement training for the MDC operators uh, using an online course and videos. So, temporary or the dates for this will be from August 17 to 21. So, the next is for the improvement of the MVC database or the synchronization of the databases from the spokes and the hubs, the patient records, and electronic forms. So, for now, hindi ko masyado na kanina na-emphasize, no? So, ang nangyari po kasi, yung records na nakukuha doon sa Agnes, nasi-save siya doon sa PC or doon sa telemedicine machine. Yung machine po kasi may Windows na operating system yan. So, ganun din siya nag-work as a desktop din or laptop. So, yung folders, for now, yung folders nun, ang nangyayari, sinisecure lang po ng ating mga medicine staff. Wala pa tayo nung talagang sinasabi nila na EMR, yung electronic medical record na designed for this particular device. Kasi nakausap namin po yung suppliers, in order for us to do that, kailangan natin ng servers na medyo expensive and exhaustive, no? Na kailangan din ng high maintenance. So for now, siguro in the future, hopefully makapag-provide na. Pero for now, yun po muna yung workaround. No? So we will be receiving them as soft copies sa mga desktop and telemedicine equipment natin. And yung hard copy, syempre for hospital records, that can also be printed. If you want to use yung hospital records, no, as the hard copies, wala rin naman pong problema. Then, next, for the development of the Calabarzon Monthly Bulletin for Telemedicine Project. So for now po kasi, in order to access the updates, you may contact us via email or dun sa aming pong Facebook page, yung ID po na Facebook page. Nandun po kami nagbibigay ng update. Pero eventually, we will be making a monthly bulletin for the telemedicine project. And lastly, we were exploring partnerships with specialty hospitals in Manila. This was actually ongoing na po sana. However, bigla pong nagkaroon ng COVID. No? So we have already coordinated with Lung Center, Heart Center, PCMC, and other specialty hospitals na hawak po ng DOH. And some of them responded na in a positive way. However, yun nga po, due to COVID, nagkaroon lang po ng problema. So hopefully in the future, we will be able to also tap them. So that ends my presentation, our presentation. So we're open po for questions and concerns,
Okay.
clarification.
So, thank you very much. First kay Ma'am Elaine for the introduction, overview, and scope of telemedicine. And to Dr. Dan Pasion, giving us the telemedicine procedure, the roles and responsibilities of both the spoke and the hub. So, maraming salamat. So, we'll now proceed for the Q&A. So, meron na po tayong question from Dr. Ana Carmina Santua from the Department of ENT. And I believe pwede siguro itong ma-answer ni Doc Dan. The question is, hi, may I ask if we can view the informed consent given to patients again?
Hello, Doc. Apo. So,
Apo.
thank you po, Doc Ana, for that question. Yes, you may po. Lahat po nung forms na na-mention earlier, you may be able to access them. Magpa-access lang po kayo kay Miss Maridal and Sir Albert para makipag-coordinate sila doon sa spoke para ma-provide po kayo. Also, since nabanggit na rin po to, not just yung informed consent, yung mga previous, since nakatabi po yung mga records ng patients, yung mga previous consultations nila, whether that be yung mga previous pictures or yung mga notes niya before, pwede niyo po silang ma-access yung mga prescription niya before. Ayun po, nakasave po sila lahat.
Hello, Doc Dan. Baka Dr. Santua would like to see yung sa presentation mo kanina, the actual informed consent form.
Okay,
Baka,
okay.
yes,
Sige
please,
po.
ano.
Open ko na lang po yung mismong Word file.
Reminder to all participants po, please register your names po dun sa provided na link sa upper part kasi we will be getting the names dahil mag issue po kami ng certificate of attendance to all participants. So this will be signed by our Regional Director, Eduardo Hanairo. So paki-register na po yung names nyo. Okay pa.
Pag-mention yung bagay. Kita po ba?
Paki-read na lang siguro,
First,
Doc.
sige ma'am. So, sa taas po, merong name of province, name of municipality, barangay, the date, agent number, then the medical visa consent form. Meron po tayong English, meron din po tayong Tagalog. So, for the English ay blank of blank age, then meron po male or female, lives at kung anong address po, hereby provides consent to being examined through the medical video consult project of the telemedicine program performed by a duly licensed physician to assess my current health status provided that findings be securely documented and filed diligently. Be it known that this consultation is governed by the Medical Act of 1959. It was fully explained to me that the findings may be utilized and referred to specialists for further evaluation and management, but efforts will be made to conceal my identity to the fullest. I understand that in case I was not able to disclose relevant information that may lead to complications, the doctors or institution will not be held liable in any way. So for the Tagalog version naman po, ako si blank with the name and the age. So, blank edad, babae or lalaki, na nakatira sa aking address, ay pinahihintulutan ko na suriin ako ng lisensyadong doktor mula sa magkahiwalay na pasilidad o lugar gamit ang teknolohiyang pangmedikal na telemedicine upang suriin ang kasalukuyang kalagayan ng aking kalusugan. Anuman ang makuhang detalye at impormasyon mula sa akin ay ligtas na maitatabi para sa mga susunod kong konsultasyon. Alam ko na ang konsultasyon na ito ay sakop ng Medical Act of 1969. Ito ay ganap na ipinaliwanag sa akin na anuman ang makita o masuri sa aking kalusugan ay maaaring isang uni sa nararapat na espesyalista para sa masigling pagsusuri, ngunit sisiguraduhin maitatago ang aking pagkakakilanlan. Naiintindihan ko na kung may impormasyong hindi ko maibahagi, ay maaari ito magdulot ng komplikasyon at walang pananagutan ang doktor o institusyon dito. Then, sa baba po ay yung lagda ng pasyente. Then, meron pong short details, no? Chief complaint, name of doctor, name of facility hospital, then the consultation outcome, yung yun po, kung nalagyan ng prescription details, medicine, and kung sino po yung nag-assist, nakasign din po na medical video consult na health worker. May, ah, yung forms po natin, if ever po, no, so kung napansin niyo po kanina dun sa presentation, ano po tayo, proactive po tayo. So, kung if ever meron po kayong suggestions for improvement, kunwari dito sa informed consent form natin, you may send them via the plural lapitan and sa mga NDC operators natin para makarating po sa amin. And titignan po natin kung pwede natin ma-incorporate po dun sa mga existing forms natin. Actually, this was already revised kasi may mga concerns na po before nung ating pilot phase regarding dun sa na liability.
Add lang ako, Doc Dan. Oo, kasi ang in-emphasize dun sa consent is the Medical Act kasi at the moment wala pa po tayong e-health bill that will cover the telemedicine liability, no? So it stands still yung Medical Act po pa rin natin. So the same pa rin pa naman po. So the referring physician will be liable po dun sa ating patient po. So yun po.
Thank you, Dan and Ma'am Jane. So, meron pa po ba kayong questions? Meron pa po tayong questions? So, meron din po tayong mga interns. So, we are joined by our new batch of interns. So, I see 8 new batch of interns. So, welcome sa inyo. So,
So, mukhang wala pong ibang habang wala pang nagtatanong, no? Gusto ko lang din pong i-clarify, no, na the pictures during the presentation shown by Miss Elaine, lahat po yun during good quality na internet connection. So, pag na-experience nyo na medyo blurry siya or parang pixelated, yun po, na nangyayari or nangyari before, that is due to the ano po, connection po. So, usually nangyayari yun pag mahangin daw or pag umuulan dun sa ating mga spoke area. Then, for the actual consultation, hindi naman po siguro tayo maninibago dahil lahat naman po tayo para-parehas ng ginagawa, no? History and physical examination. Wala naman pong bago aside dun lang sa physical examination side na magiging hindi na actual, no? So, mag-instruct tayo dun sa mag-a-assist sa atin na gumawa. So, yun po. In terms of ano pala sa prescription, baka may nagtatanong paano isa-sign. So, previously, may mga, nung wala pa dong COVID, nag-deploy po kami ng mga digital signature pad. So you may use that device para magkaroon ng e-signature. Pero ngayon po na naglabas na yung FDA natin ng bagong guidelines, so pwede nyo rin tinatanggap yun sa mga pharmacy yung written prescription tapos pipicturan. So whatever you prefer po.
Doctor? Dr. Villanueva, may I say something?
Yes po, Doc.
Yes. Doctor, kaya ako pina-join kasi ang mga interns. As we all know, because of this COVID, the APMC has a directive that they cannot go on duty sa OPD natin. So, isang option na naisip ko para magkaroon din ng clinical exposure ang mga interns, parang OPD setup, is through this telemedicine. Sabi nga ninyo, merong spoke doon. Tapos nakita ko lahat ng mga equipments available dun sa kabilang side, and then makukuha namin dito sa side sa BAT-MC. So, I think this is a good way for the interns to learn something. Kaya nag-request ako kay Dr. Lepit, and I thank you very much din sa inyong end for allowing the interns to attend. So, ito yung OPD ng mga interns namin sa BAT-MC. So, lahat ng department, I think, makikater kasi may abdominal ultrasound, merong even ECG, nakita ko meron. And then, meron pang magandang view ng, is it otoscope, ha? Yes. So, I think it's a good learning, good learning activity sa kanila. So, thank you very much, Doctor.
Thank you po for that comment, Dr. Alves. If I may share, yung ating isa pang hub, yung Quezon Medical Center, during the pilot phase po, they actually allowed some of their interns na mag-assist po dun sa ating consultation. Actually, meron po yung kuha dun sa video na pinakita kanina. So, yun po, I think it is parang way forward na sa ating medical
Yes.
school ngayon kasi iba na talaga, iba na po yung curriculum nila dahil nga po sa
Yeah,
COVID.
exactly.
So yung lack of skills, I think hindi pa rin talaga nila makukuha kung ano yung mga natutunan sa ospital and sa mga OSCE natin. Pero
Yes.
I think kahit pa paano, better than nothing.
Yeah.
So,
Well,
yun po, hopefully may makuha rin po sila.
So it's more technology-centered na ngayon. Yeah.
Yung
Thank
ano
you.
naman po, in terms of yung mga theories kung paano gamitin yung devices, they are basically the same. Aside lang po siguro dun sa ophthalmoscope. Kasi yung ophthalmoscope, hindi na kailangan ng dye para makita yung mata. And hindi na ah, yung view po niya is black and white dun sa nag-assist sa scope. Pero pag pinicturean nila, same pa rin naman po siya na red orange. Aside from that, all the plugins are basically the same naman po. Ganun din po
Thank you.
yung makikita nila sa actual hospital setting.
Thank you.
Also, may I add, so we are joined by our specialist. So kasama po natin even anesthesia department, yung urology, ortho. So if ever po na kailanganin po talaga ng suspect pa po talaga na specialty, pwede po natin silang matapo at mabigyan po ng schedule. So yung temporary na schedule po na ginawa namin is meron kaming Tuesdays ng OB, ng morning, and surgery ng the next week. And then yung afternoon, internal medicine or family medicine, and then alternate with ophthalmology. Tapos Thursdays naman, same pa rin dahil nga para magamit yung ating mga gamit, OB and ENT. Tapos meron din po tayong pediatrics. So if ever po na warranted na ma-refer sa ANES for pain management or sa urology, so meron po tayo naka-join po sila ngayon, uro or ortho, even ortho. So ayan po. So ano po talaga, masisilbihan po natin ang mga patients natin both sa Tingloy and sa atin sa Quezon po. So ayan.
Po, Dr. Lapitan. So, ano naman po, with regards sa schedule, na-mention ko naman po earlier. So, before po kasi medyo strict tayo. Pero ngayon naman po, it's up to the hubs to decide kung what time and kung what specialty po yung gusto mong i-provide na service. No? So, example po, before kasi di ba nag-start na tayo at 10 a.m. But yung QMC, meron po silang start ng 9 a.m. So, pwede nyo rin pong i-adjust yung schedules nyo to cater dun sa ating mga specialist kasi alam naman din po natin medyo limited lang din po yung specialist natin and kailangan din po nila mag-function sa hospital. So, kung ano naman po yung availability nyo, kikitain naman po yun ng mga spoke natin. So, hopefully, ina-update naman po ng mga MDCITs natin yung electronic calendar. Yung mga doctors po natin, kung kunwari nakalimutan din po nila yung schedule, pwede rin po nilang tignan doon. No? So, either the spoke or the hub, pwede po mag-refer din sa e-calendar. Just ask po help from Mr. Albert Blay po for assistance.
Yes, Doc Dan. So meron po tayong nasa room 11 OPD sa ating hospital, telemedicine operators po. So si IT expert, si Sir Albert, tsaka ating nurse na si Ma'am Dal. So, yun encourage ko rin yung mga doctors natin kung gusto nilang ma-experience. So actually, start na tayo last Thursday with OB, Dr. Rawico. I think she's here. And the morning, and then yung afternoon naman is Dr. Rabo Ondaling, the Pedia Endo ng afternoon. So, meron naman sila nakita na kahit tag-isang patient na na-refer. So, magandang start na yon. So, ang next question ko is, kailan kaya tayo mag-start sa ating Loy? So, by Tuesday ba kaya? Pwede na tayo mag-start?
Pwede magtanong. Pwede magtanong.
Ay, Doc, sige po. Toratorio, RCMP.
Okay, good afternoon.
Good afternoon po.
Paano pagka, ito ba pwede dito ang psychiatry? So, marami na ngayon, alam mo na, maraming stress ngayon, anxiety, tsaka mga, pwede ba sila rin i-schedule din sa ganyan?
Bali po, Doc, if ever po na merong mare-refer na patients for psych, from both Tingloy and sa Claro po, ay mag-ask po ako kay Dr. Pineda if they can come sa OPD po. Kasi kailangan po silang pupunta.
Dapat
present
pala
po. Opo.
nakaharap dyan.
Opo, andun po kasi ang ating pong gamit.
Hindi pwede yung connect-connect. Ha? Dr. Passion, di pwede yun. Para
Good afternoon po, Dr.
ano
Tario.
ba
Apo.
tawag doon?
Yung
Naka long distance, basta may tablet, hindi pwede.
Doc, good afternoon po. Yung ano po kasi natin, yung ginagamit po natin na equipment, hindi po siya katulad ng mga ibang platforms natin. So,
Oo.
yung Agnes po kasi, since yun nga po, meron siyang specific na URL na sinesend lang po ng ating mga telemedicine
Okay.
personnel. One at a time lang po yung makaka-access via satellite yung satellite connection po nila. Pero siguro po hopefully kung in the future magkakaroon po ng mas magandang connection and work around kung magkaroon pa ng mga ibang hubs or ibang ano po. Baka pwede naman po. Pero for now, yun po yung isa sa restrictions po ng ating project.
Okay, sige. Kasi baka
Mahirap din po, mahirap din po kasi baka may questions po. So kung nasa bahay kunwari yung doctor, wala po silang matibay doon or si Albert, hindi rin po nila ma-assist ng maayos kasi may mga forms din po na kailangan sagutan. So like yung feedback and kung may concerns po, baka mahirapan pong i-assist.
Pero okay naman pagka yung ating mga forms sa sa confidentiality and data privacy. Meron naman tayong access doon sa ganyan. So when it comes to the data privacy and confidentiality of our forms and our chart.
Doc, bali yung forms po natin, so naka-save lang po sila, naka-lock po sila dun sa ating dalang device. So, dun sa hub, yung mga telemedicine equipment po natin, nakasave lang po dun. Dun sa hub, nandun naman po siya sa desktop. So, ang may access lang po nun, yung mga MDCITs natin. So, if ever kayo pong doctors, may kailangan po kayo, kailangan nyo po ng assistance po nila. yung si Mr. Albert Play po, tsaka yung mga ibang SSITs po natin.
Okay, thank you.
Doc,
Thank
meron
you,
pala
thank
akong
you.
may
Ito po,
additional po ako. For if ever po kailangan po ng counseling, primary counseling po, andyan po ang family medicine to answer po. So, pwede po yung kahit basic po na counseling po and disclosure. Kayang-kaya po yan ng family medicine. Di ba, Dr. Pau? Is Pau here? Still here?
Yes po, Doc.
Pwede po. Ayan. So, i-ano po natin ang family medicine for that. Bago i-refer po sa site.
May question po ako. Actually, confirmation lang. Dr. Karandang po sa PEDYA.
Hey, Doc.
Doktor, nabanggit niyo naman po, 'di ba po may time. So pwedeng ma-deviate yung time kung halimbawa may follow-up sila sa subspecialty. 'Di ba may oras dapat yung OB, pedia. So okay lang na halimbawa sa time ng OB gusto ng consultant namin kasi consultant sa amin na nag-check up. Kung subspec, okay lang na maiba yung time at saka ma-overlap doc sa allowed time ng ibang department.
Bale, Doc, if ever kailangan po talaga na, for example, yan nga, di ba, si Dr.
Apo.
Yun
Yeah.
tapos pulmonologist yung kailangan for the next consult. Tapos, available siya morning. So, we can adjust. Siguro kailangan lang namin ng days ahead para masabihan din natin ang ating spoke. Para mapapapunta din nila ng preferred na day and time ng patient. So, tayo na lang po yung talagang mag-a-adjust.
Okay po.
Pero ang gusto lang namin, meron tayong leeway na date na para din ma-advance natin, directive na natin yung ating patients tsaka yung sa ating mga spoke.
Okay po. Thank you po, Doc.
Okay.
then yung ano po, yung concern po ni Doc Lapitan yata, Ma'am Elaine, Doc Pat, for Tingloy daw po.
For what, Doc?
Yung Tingloy daw po, kailan daw po pwede mag-start?
Kasi for next week, magte-training pa yung mga MVC staff for the skills enhancement, 'di ba? Yung online course nila. So, we would like sana yung health workers muna be equipped before sila mag-handle ng actual patient. So, siguro after, kailan ba, Doc, yung after the training next week?
Okay lang. May schedule na tayo.
Kasi yung training, Doc Pat, is target namin the whole week next week. Kasi parang may modules yun eh. Parang series of videos to be watched. Tapos may pre and post test para ma-check namin yung skills nila if nag-gain or not. So, 17 to 21, the whole week, pang training siya ng mga staff. Kasi kasama doon yung mga other, mga health workers. Na. Okay. So, siguro we can start 25, August 25.
Until
Kasi every Tuesdays and Thursdays for Bat MC. So, for Tingloy, start tayo Tuesday.
Pinanilagay ko. Akong gumawa ng
no
ABC
problem.
ng
Okay,
reagent at
sige,
saka
sige.
ng
Okay.
equipment.
Kaso Dok, yung reagent na 6M,
Ha?
So,
Doc
thank you.
Lapitan.
reagent na
Yes.
6M,
Thank
good
you.
Apo.
for
So,
2 weeks
August
lang ba po
25 po,
yun?
ano na namin for Tuesday.
May mura
So,
naman.
usually naman
Apo.
po
Ari,
ay,
mamaya
may naka-plot na po kami ng mga departments po
Marami
nun. So,
basta mamaya.
calling OB, surgery, IM, off task.
Kasi yun ay
Apo.
Sila po
branded.
yung
Then,
possible na ma-reference.
Eh
baka po
sabi ko,
next
kasi
week,
nagmamadali naman
technology testing
tayo.
na lang tayo between Tingloy and Bat MC. No, yung IT po natin sa Bat MC, si Sir Albert, i-test niya po kung makakonect siya sa Tingloy na lang for next week. So, puro technology testing na lang po tayo for next week. Saka training. Okay po.
Thank you. So, meron pa po ba tayong questions? Sa iba pa pong mga doctors na kasama natin?
Doc, may nag-chat po si Dr. Ana Zagua. So,
Sige.
uh, may I ask if the otoscope has both adult and pediatric tips For the otoscope, opo, marami pong disposable tips po na binigay kasama ng otoscope. So, pwede po siya sa adults and pediatric po. And also can be referring in use the otoscope for anterior rhinoscopy. Ayun po, kung since marami naman po yung disposable na tips natin, I think pwede naman po. Depende na lang po dun sa referring physician kung most likely okay naman po na gamitin sa kanila.
Okay, thank you.
Answer po yung question.
Opo. So, re-remind ko lang din po yung sa ating office, sa hub, sa room 11 is, ano po, we still practice pa rin naman po ang physical distancing doon. And of course, na naka-mask naman po yung ating mga telemedicine operators. Plus, limited din po yung tao doon sa loob. So, to ensure privacy din. And of course, for safety and protection. Ayan. Tapos kung pwede nyo naman po kayo, kung gusto nyo po, magdala na rin kayo ng sarili nyong headset, kung gusto nyo meron. Pero meron po talaga itong provided na headset na po eh. So, kung gusto nyo, meron na rin kayo. So, wala namang problem.
If I may
And
add, Dr. Lapitan.
yes, ma'am.
Apo, after the consultation po kasi, we have the feedback from the doctors, no, na uupo do'n. So, if they encounter difficulty, kunwari po, nahirapan yung staff na nandun sa spoke to navigate yung, kunwari po yung ultrasound, then pwede pong ilagay ng doctor do'n na we propose or recommend training of the staff regarding ultrasound, parang maneuvers. So, yun po. Actually, yun po yung isa sa mga tinake namin from the previous advanced implementation. May mga comments po din yung mga doctors. Kaya very important po na makuha natin yung mga feedback from the doctors that will attend the telemedicine. Yan na po.
Yes po. Thank you for reminding, Ma'am Elaine. So, mag-answer nga po ang ating mga doctors after ng procedure ng parang evaluation form doon. And then, of course, itatago naman po yun nila, Ma'am Dal. So remind ko lang din po sa lahat po ng participants to sign up dun po sa sinishare sa chat na Google Drive para po sa attendance. Kasi magkakaroon din po tayo ng certificate. So wag po natin kalimutan na mag-sign. Okay. So kung wala na pong question, time check is 3:18 p.m. So can I call on now our Chief of Medical and Professional Staff, very hardworking and very supportive, Dr. Marites Tatsitatorio for the closing remarks. Doc, naka-mute po.
Okay. Thank you. Sa totoo lang, di ako makapirma doon sa inyong link. Anyway, hindi ko alam eh. Sige, good afternoon again. Thank you for having that telemedicine. Very high-tech na tayo within even the remote area of Tingloy. Mararating natin. And we have consult in there. Very useful talaga ito. Actually, ito dapat 5 years ago pa. Now nalaan nangyari dahil talaga naman delayed ang ating Philippines. Anyway, basta mas mahirap nga basta we have a vision na we will have an increase in our technology. Hopefully, in the next future, in the next years, magkaroon tayo na not only in Tingloy, not only in Clarinecto, but also the different municipality or HUs so that our public health unit can navigate on the different RHUs. And then I hope that all mga interns can also learn from this telemedicine and be updated dito sa ating mga innovative technological updates. And then, thank you for attending all, and thank you, Dr. Passion, Ms. Elaine Peralta, Dr. Lapitan, Dr. Risa, hanggang ka pala, akala ko. And then, thank you to everyone who joined this meeting. So, and thank you talaga sa CHD4A for conducting, having this telemedicine and teleconsult. So, God bless, God's here, and Godspeed. Thank you. Bye.
So thank you so much, our
Okay.
CNPS Dr. Marites Torio. So napaka-supportive po niyan. So maraming salamat din po sa ating CHD4A, kay Sir Henry for sharing po yung advanced implementation YouTube video. So maganda na ma-reminisce, makita ulit yung dating mga
Welcome po,
na-experience ng
welcome.
BAT-MC and with CHD4A. So with that po, magpi-picture taking po ba tayo para po ma-document? Pero puwede po ba itong
Natin na sa Hospital Week. Oo.
opo, in
Oo.
celebration of the National Hospital Week po,
Oo.
kaya po meron tayong ganito. Ayan, yan paki-turn on na lang po. Teka po, I will try to screenshot. Ay, teka.
While preparing for the picture po, yung video po kanina, kung medyo malabo po sa device nyo, pwede nyo po siya ulit panoorin sa YouTube. Sinend po yung link dito sa chat box natin. Ayun dito. Pwede nyo po
Ayan.
tingnan.
Tapos po ano po, this is being recorded. So, para po puwede rin po ma-play yung mga hindi po naka-attend ng orientation seminar. Ayan.
Okay
So,
na picture?
okay na po ito. Okay. So, ako na po magpi-picture. Okay. Smile. 1, 2, 3.
Teka, paano ba mag-smile? May mask. Ulit. Tay.
Sige po.
Naka.
Yan. Okay. Sige po. Tingin po dun sa webcam ha. Ayan. And then smile. 1, 2, 3. Ayan. Okay na po. So,
Okay, thank
tag ko
you.
na lang po kayo sa Facebook ng aming mga Facebook friends. So, marami pong salamat sa inyo pong pagdalo.
Thank you very much din
Dr.
po for
Risa,
inviting.
thank you po.
Kaya rin po,
See you
BAT-MC.
again. Ingat po lahat.
Maraming salamat po. Ingat po lahat.
Okay po.
Thank you.
Bye.
Stay healthy.
Well, stay safe.
Kumusta kay Dr. Pasyon, ha? Pagod
Makakarating po.
pa.
Makakarating.
Si
Thank you,
RD.
Dawan.
Si RD rin. Okay. Bye-bye.
Thank you so much.
Thank you po. Bye.